somewhere between 6,500 and 2,000 years before the Common Era. A person lay down, fully conscious, while someone else cut a hole directly into their skull. The tool was sharpened stone. There was no anesthesia, no antiseptic, nothing to blunt the pain beyond whatever the era could offer. You already know how this story ends because it feels obvious. Nobody survives skull surgery performed with a rock and no germ theory, except the skulls say otherwise, and they have been saying it for over a century. This practice is called trepanning, sometimes trephination, and it means opening the skull by scraping, boring, cutting, or drilling through bone until the brain's protective covering is exposed. Archaeologists have found it on every inhabited continent except Antarctica, performed by cultures that never had contact with each other, using nearly identical techniques. That alone should tell you something. This was not one isolated ritual. It was a solution that kept getting reinvented. Picture the actual procedure for a second, because the alien part is not the drilling, it is the calm. 4 techniques show up repeatedly in the archaeological record: scraping the bone away layer by layer, cutting a rectangular section with intersecting grooves, boring a ring of small holes and connecting them, or drilling straight through with a rotating tool. Scraping could take over an hour, done with a sharp-edged stone or shell, grinding down through skull thickness that averages around 6 millimeters in an adult. The patient was awake for most of it, because losing consciousness from blood loss or shock during an open skull procedure is its own kind of danger. If you are picturing chaos, stop. Because the physical evidence suggests something closer to a controlled surgical setting, with a practitioner who had clearly done this before. Here is the part that should stop you cold. In 1865, an American diplomat and amateur archaeologist named Ephraim George Squire brought a skull back from Peru. It came from a burial site in the Ucay Valley, and it had a rectangular hole cut into the frontal bone, roughly the size of a large coin. Squire assumed, like most people would, that this was evidence of a fatal or ritualistic wound, so he brought it to Paris to show it to the leading anatomists of the day. He handed it to Paul Broca, a French physician and one of the founders of modern neuroanatomy, expecting confirmation of a violent death. Broca looked at the edges of the hole and saw something nobody expected. The bone around the opening was smooth, rounded, and showed clear signs of new growth. Fresh cut bone is sharp, jagged, and shows no healing response, because a dead person's skeleton does not remodel itself. This skull's edges had softened and regrown, which meant only one thing. The patient had lived long enough afterward for the bone to heal. Broca presented his findings to the Société d'Anthropologie de Paris in 1867, and it upended a basic assumption doctors had carried for decades. Ancient people, working without anesthesia or antiseptics, had performed skull surgery that patients regularly survived. Once researchers knew what healed trepanation looked like, they started finding it everywhere, and not as a rare fluke. A Neolithic skull discovered near Ensisheim, France, and dated to roughly 6,500 before Christ, shows a fully healed trepanation, making it one of the oldest confirmed surviving surgical patients on record. That is not one lucky outcome. That is a pattern stretching back to before written language existed anywhere on Earth. So why does a skull surgery with a rock actually work? The honest answer is less mystical than you would expect, and more procedural. Many of the skulls examined show trepanation performed near a site of an existing skull fracture, particularly depressed fractures from blunt trauma. That reframes the whole picture. This was not primarily a spiritual ritual to release evil spirits, though some cultures likely used it that way too. In a large number of cases, it looks like functional trauma surgery, relieving pressure from a fracture or bleed the same way a modern neurosurgeon would today. A skull fracture that pushes bone fragments inward, compresses the brain, and raises intracranial pressure. And if nothing relieves that pressure, the patient dies from the swelling itself, not the original blow. Ancient practitioners across unrelated cultures appear to have independently arrived at the same conclusion. Cut a hole, relieve the pressure, and the patient has a real chance. This is where the story stops being a curiosity and starts being genuinely disturbing in a different way. because it means these were not improvised experiments. Bioarchaeologist John Verano at Tulane University has spent decades studying trepanned skulls from Peru, examining hundreds of specimens spanning roughly 2,000 years of Andean history. His research tracks something remarkable. Survival rates measured by evidence of bone healing appear to improve significantly across the centuries, moving from a meaningful minority in earlier periods to the clear majority by the late pre-Columbian era. Read that again, because it is the detail that should really unsettle your assumptions. Success rates went up over time, the exact signature of a discipline being refined through practice. Techniques became less invasive, hole sizes shrank in later periods, and practitioners appear to have learned which methods caused fewer complications. That is not what superstition looks like. That is what a surgical tradition looks like, when it is iterating on outcomes across generations. Meanwhile, on the other side of the world with no possible contact, Greek physicians were formalizing the exact same procedure in writing. Hippocrates, writing around the 5th century before Christ, dedicated an entire treatise to head injuries titled On Injuries of the Head, describing precisely when and how to trepan a fractured skull. He warned against drilling directly over the skull's suture lines, where the bone is thinner and blood vessels run closer to the surface, a detail that shows real anatomical observation, not guesswork. He also cautioned against boring too aggressively in one continuous motion, recommending the surgeon periodically remove the tool to cool it and check depth to avoid overheating and damaging the membrane beneath the bone. That is not ritual language. That is a working surgical protocol, written down and taught to other physicians. The practice did not stop with the Greeks either. It traveled forward through Roman medicine, through Islamic Golden Age surgeons like Abu al-Qasim al-Zahrawi, and straight into medieval Europe. The 14th century French surgeon Guy de Chauliac included detailed instructions on trepanning for skull fractures in his surgical text, Chirurgia Magna, still widely referenced by European surgeons for centuries afterward. By this point, you should be noticing something. This procedure did not fade out as medicine advanced. It got carried forward, generation after generation, because it kept working. So here's the turn nobody sees coming, and it is the whole reason this topic deserves a second look. Walk into a modern hospital's neurosurgical unit today and ask what happens when a patient arrives with a severe brain bleed or dangerous swelling from trauma or stroke. The answer is a procedure called decompressive craniectomy, where surgeons remove a section of the skull to give a swelling brain room to expand without crushing itself against solid bone. Strip away the imaging equipment, the sterile field, and the anesthesia, and the underlying logic is identical to what a Neolithic practitioner understood 8,000 years ago. Pressure inside a sealed skull kills, so you have to let it out. Even the more basic version, a burr hole to drain a subdural hematoma, is essentially trepanning with better tools and a lot more precision. It gets stranger. In genuinely remote or low-resource settings, where transport to a full neurosurgical suite is not realistic, physicians and trained field surgeons still sometimes perform emergency burr hole procedures using compact, manual hand drills. Documented cases exist of missionary doctors, ship's surgeons, and rural clinicians performing life-saving emergency burr holes with hand-cranked tools because a hospital with proper equipment was simply too far away. The tool has changed. The materials have changed. The core action, opening a controlled hole in the skull to relieve pressure on the brain, has not changed in any fundamental way in thousands of years. That is the part that collapses the distance between then and now. This is not a story about how primitive ancient medicine used to be. It is a story about how a handful of ancient surgeons, working with stone and no concept of germ theory, correctly identified a problem that still kills people today, and built a working solution for it. The Peruvian surgeons refining their technique across centuries, the Greek physicians writing protocol into medical texts, the medieval Europeans carrying it forward, and the neurosurgeon opening a modern skull tonight, are all running the same basic operation. What actually separates them is not the idea. It is imaging technology, anesthesia, antibiotics, and sterile technique, all of which exists specifically to make the same core procedure survivable, at a much higher rate. The myth was never really that trepanning happened. Everyone accepts that it happened. The myth is that it was a death sentence dressed up as medicine. It was not. It was an early, blunt, occasionally brilliant answer to a problem. The human skull creates for itself the moment it swells, and modern medicine never actually replaced the logic. It just gave it better tools. If a rock and a steady hand could keep patients alive long enough for their bone to heal around the wound, it is worth sitting with how little the fundamental idea has moved since then. If this rewired how you think about ancient medicine, there is a whole channel of these waiting for you, so stick around and keep questioning what you assumed was obvious. Keep ingesting education.